Isotretinoin is a retinoid used to treat severe recalcitrant acne. In this video, let's found. What is isotretinoin? What is isotretinoin used for? Contraindication. What are the side effects of taking isotretinoin? How does isotretinoin work? How to use isotretinoin? What is isotretinoin? Isotretinoin, also known as 13-cis-retinoic acid and sold under the brand name Accutane among others, is a medication primarily used to treat severe acne. It is also used to prevent certain skin cancers, and in the treatment of other cancers. Isotretinoin was patented in 1969 and approved for medical use in 1982. In 2020, it was the 264th most commonly prescribed medication in the United States, with more than 1 million prescriptions. What is isotretinoin used for? Isotretinoin is indicated to treat severe recalcitrant nodular acne in patients greater than or equal to 12 years enrolled in the iPledge program. Contraindication. Isotretinoin must not be taken in pregnancy, or if there is a significant risk of pregnancy. Blood donation by males and females on isotretinoin is not allowed in case the blood is used for a pregnant woman. Side effects. Crusting of the skin. Difficulty in wearing contact lenses may continue after medicine is stopped. Dryness of the eyes may continue after treatment is stopped. Dryness of the mouth or nose. Dryness or itching of the skin. Headache, mild. Increased sensitivity of the skin to sunlight. Pharmacodynamic. The pharmacodynamics of isotretinoin are poorly understood. Mechanism of action. Isotretinoin produces its effects through altering progress through the cell cycle, cell differentiation, survival, and apoptosis. These actions reduce sebum production, preventing the blockage of pores and growth of acne, causing bacteria. Isotretinoin and oxoisotretinoin both significantly reduce the production of sebum. Isotretinoin has little to no affinity for retinol-binding proteins, RBPs, and retinoic acid nuclear receptors, RARs. Tretinoin and 4-oxotretinoin bind to the RAR gamma receptor, which is suspected to be part of the acne treatment by isotretinoin. Isotretinoin induces apoptosis in sebocytes, leading to a decrease in sebum production. Isotretinoin also reduces the formation of comedones by reducing hyperkeratinization through an unknown mechanism. Isotretinoin does not directly kill bacteria, does reduce the size of sebum ducts and makes the microenvironment less hospitable to acne-causing bacteria. It may also increase immune mechanisms and alter chemotaxis of monocytes to reduce inflammation. Half-life. The half-life ranges from 7 to 39 hours, with a mean elimination half-life of 20 hours. The half-life of 4-oxo-13-cis-retinoic acid ranges from 17 to 50 hours, with a mean elimination half-life of 25 hours. Dose. For acne. Adults and children 12 years of age and older, dose is based on body weight and must be determined by your doctor. Absorica and Accutane, the dose is usually 0.5 to 1 mg mg per kilogram kg of body weight per day. Take 2 divided doses for 15 to 20 weeks. Your doctor may adjust your dose as needed. Absorica LD, the dose is usually 0.4 to 0.8 mg mg per kilogram kg of body weight per day, taken as 2 divided doses for 15 to 20 weeks. Your doctor may adjust your dose as needed. Children younger than 12 years of age, use and dose must be determined by your doctor. Safety advice. Advice and warnings for the use of isotretinoin during pregnancy. FDA Pregnancy Category X, not for use in pregnancy. That's all the information about isotretinoin we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.